On tonight's episode of 15 Minutes, we have Rachel Zakor, a coma survivor, and she's here to tell her story. I'm your host, Alio Zarzak. Thanks for joining us tonight, Rachel.
Thanks for having me.
So, Rachel, what happened to you was very traumatic and rare in your case. Can you please tell us a little bit about your attack?
Sure. It was kind of like any other day, really. I was walking home. It was late, really, really late at night. I'd gotten out of my films class late, and I was walking with my hoodie up because it was cold and it was kind of a depressing day, really. I just didn't see anything. I felt it first, actually. I felt something really heavy and blunt hit the side of my head, and from there I just went down. I blacked out. I don't remember anything from that point up until waking up in a hospital bed, and there were people standing all around me, and I was obviously very confused, had no idea where I was, and I was dizzy, felt throbbing in my head, and
Did you know what day it was?
No clue. It could have been 10 minutes later, it could have been 2 years later. I had no idea. And I actually looked over and I saw a guy in a white lab coat, and I said, "Are you my doctor?" And he said, "Yeah, do you know where you are?" And I said, "No, I had no idea." And I said, "Well, you've been in a coma for 2 weeks." And I was shocked.
I can imagine.
It was awful. All I could think of was what happened,
Mm-hmm.
why am I here? And it was terrifying, really.
I'm so sorry to hear that. Coming up after the break, we have 2 neurology experts who will help us understand Rachel's injury.
A coma is defined as a state of prolonged unconsciousness in which an individual exhibits no voluntary movement or behavior.
How a comatose occurs. Illnesses that affect the brain and brain injuries can both cause comas. If a person suffers severe head trauma, the impact can cause the brain to move back and forth inside the skull. The movement of the brain inside the skull can tear the blood vessels and nerve fibers, which causes the brain to swell. This swelling presses down on the blood vessels, blocking the flow of the blood to the brain. The oxygen and blood-starved parts of the brain begin to die. Some infections of the brain and spinal cord can also cause the swelling of the brain. Conditions that cause an excess of blood inside the brain or skull, such as skull fractures or burst aneurysm, can also lead to swelling or further brain injuries. As with most mental processes that occur in the brain, the biology of consciousness, which is also arousal, is very complicated and not well understood. There are many tissues located deep within the brain that play a role in how consciousness and alert a person is. Researchers believe that one of the important physiological processes that keeps a person conscious is the neurotransmission of chemical signals from the brainstem to the cerebral hemispheres. This continuous neurotransmission needs to be happening in order for a person to be aware of their environment.
The central nervous system structures that are affected by a coma all play a role in consciousness. 3 large areas of the brain seem to be especially involved in the phenomenon of consciousness. The first is the reticular formation, whose activity level influences the states of alertness, wakefulness, and sleep. Second is the thalamus, which sorts the information from the rest of the body and routes it to other parts of the brain. And finally, there is the cortex, which is of crucial importance for all forms of perception and all control of voluntary movement.
Hi, I'm Dr. Hobart,
And I'm Dr. Merrifield,
and we're neurologists.
who specialize in the treatment of comatose patients.
Comas can be caused by a multitude of factors, extending from mildly traumatic to severe. Some examples include, but are not limited to,
Traumatic brain injuries, which are the most common cause of comas. These can range from mild to severe direct blows to the head, as well as whiplash resulting from car accidents, acts of violence, and open or closed head injuries.
swelling of the brain tissue that increases pressure within the brain.
Medically induced coma, which is ordered by a physician in order to protect the brain from swelling after an injury. the patient receives a high dose of anesthetic that results in a lack of feeling and awareness, and the patient enters a deep state of unconsciousness.
Bleeding on the brain.
Stroke, due to reduced or interrupted blood flow to the brain.
Blood sugar levels. This includes hyper or hypoglycemia, which is low or high blood sugar levels. This is usually reversible when the individual's blood sugar level is returned to normal.
Oxygen deprivation. In addition to stroke, the brain can be deprived of oxygen in other ways, such as heart attack, drowning, or even choking.
Infections of the central nervous system. This can include meningitis or encephalitis.
Toxins, including drugs and alcohol.
And even though a single seizure usually doesn't result in a coma, multiple seizures, as in the case of epilepsy, prevents the brain from fully recovering between episodes, potentially resulting in a coma.
Treatment for comas vary and are typically dependent on the cause of the coma. When you're treating a coma, you're primarily treating the cause, while sustaining life in intensive care units in hopes that the brain has recovered enough to return to some level of function.
Oftentimes, different types of medications are used to 1. Fight infections with the use of antibiotics. 2. Reverse diabetic shock through the administration of glucose. 3. Prevent seizures. 4. And decrease swelling of the brain, such as diuretics, which help reduce the amount of fluid surrounding the brain, and therefore decreasing intracranial pressure.
Aside from medications, the patient is cared for in an intensive care unit in a low stimulation environment in order to allow the brain to recover. The room is kept quiet, dark, and cool in order to minimize brain activity. The individual is kept on a ventilator, catheter, IV fluids, and a heart monitor. Vital signs and neurochecks are continuously monitored in order to detect any changes. If necessary, a craniotomy may be performed, which is a procedure involving drilling a hole or removing a section of the skull in order to relieve pressure. Occasionally, an intracranial pressure monitor is inserted into the brain to monitor swelling in severe cases.
While there are different causes and treatments of a coma, there are also different levels indicating the severity of the patient's coma. Several scales are used to assess the severity. However, the most common is the Rancho Los Amigos scale, also referred to as the RLA scale. This scale also includes assessing the patient as they improve or stabilize through their coma rehab. The RLA scale involves 8 levels of a coma. They include the following.
Level 1 includes the patient having absolutely no response to any stimuli, and the patient physically appears to be in a deep sleep.
Level 2. The patient has generalized responses and reacts to stimuli inconsistently with no purpose. Examples include blinking and changes in breathing rate.
Level 3. The patient reacts to stimuli but inconsistently, such as turning their head in the direction of a sound, but it doesn't happen consistently or it's delayed.
Level 4. In this state, the patient is confused and agitated and unable to process information and often exhibits an unusual behavior.
That's some unusual behavior.
Level 5. The patient is confused and is unable to respond to complex commands in a purposeful manner.
Right foot, let's stomp. Left foot, let's stomp. Charlie Brown. Get out now. Slide to the right. Slide to the left. Take it back now, y'all. Cha-cha now, y'all.
Level 6. The patient is confused and relies on external input from other individuals to complete tasks such as self-care activities.
Level 7. The patient is self-aware and able to perform activities of daily living, but is unable to perform higher levels of functioning and cognition.
Level 8, the last level. The patient is alert and doesn't need supervision, but struggles with tolerating stress and judgment in emergency situations, as well as emotional and intellectual capacities.
In Rachel's case, she entered her coma at a level 2 with some generalized responses, and over the 2 weeks she progressed through all the levels of the RLA scale.
Joining us now is Dr. Delaney, the comatose prognosis specialist. She is here to tell us about the longevity of a coma and its after effects. Dr. Mallory, what occurs when someone first comes out of a coma?
So when first emerging from a coma, a patient might not be able to focus their eyes, they might not respond to loved ones, or they could just be staring off into space. Part of this is from their injury, while the other part is from the medicine. At first, movements might be random, like flailing their arms, and then they may progress to semi-purposeful, like pulling on the tubes on their face. The patient's awareness of self and his or her surroundings increase as they improve and get better. Visual and auditory tracking is another sign of improvement. This is following sights and sounds throughout the room. The next stage of improvement is following some commands intermittently and is also consistently tracking sights and sounds. So after having a severe brain injury, and the prognosis after it often involves a coma that extends past 2 weeks. In far fewer cases, the coma actually makes it to a full month. The majority of people who have survived a coma for less than 1 month have what we would call satisfactory recoveries and a good prognosis after their brain injury. As a coma lasts more than a month, it indicates an increasing chance that the survivor will be very much disabled. The coma that extends past 2 months involves almost a statistical certainty that normal adult functioning will never be regained.
So with Rachel's condition, she was brought to the hospital 20 minutes after her attack. Does time have an effect on a coma?
So yes, time does play a very important role with comas. So the outcome of a patient can be associated with their best response in the first 24 hours after an injury. Using the Glasgow Coma Scale, which ranges from 3 to 15, with 3 being a person in a coma with the lowest possible score, and 15 being a normal appearing person. So 15 is the score that you're kind of trying to reach and hope for. And research shows that if the patient is 3 to 4 on the scale after 24 hours of being in a coma, 87% of those individuals will either die or remain in a vegetative state, and only 7% will have a moderate disability after recovery. Studies show that patients remaining in a vegetative state for at least a year after recovery are unlikely to gain consciousness, although they may live for many years. Patients over 40 years of age have a poorer rate of recovery than younger patients post-coma. So 90% of brain-injured patients who are vegetative for 1 month will fail to improve to a better state. However, 2/3 of patients who were unconscious for 2 weeks or less may make a moderate to good recovery. The common cause of coma is oxygen deprivation. Anoxia refers to a complete absence of available oxygen, while hypoxia describes someone who had available oxygen but at reduced levels for a period of time.
What are other dysfunctions that can occur in severe coma patients that regain the consciousness?
So there was a study performed based on information of patients who suffered from moderate to severe TBIs and then who received acute medical care and inpatient rehab services at a TBI model system 2 years post-injury and coma. Most people continue to show decreases in disability. And then I have some statistics. 34% of people required some level of supervision during the day and or night. 93% of people are living in a private residence, so on their own. 34% are living with their spouse or significant other. 29% are living with their parents. 33% are employed. 29% are unemployed. 26% are retired due to any reason, and 3% of the patients who were studied are students.
Thank you for your time.
Thank you for having me.